Welcome and good evening to all of you, wherever you are joining us from. I'm Preeta Harikrishnan, a Deputy Manager of the Department of Admissions at Amrita Health Sciences, Kochi campus, and I'll be your moderator for today's session. Thank you for taking the time to join us for this informative webinar on the need and scope of the cardiovascular technology course. To make sure we are helping you the best, we have the chat box to send your doubts. The doubts will be cleared towards the end of the session. Before we get started, I would like to introduce our esteemed guest speaker for today, Dr. Praveen G. Bai Sir, Clinical Professor in the Department of Adult Cardiology. Dr. Praveen Sir has completed his DM in cardiology from Mahi, Manipal. He's currently working as an interventional cardiologist and electrophysiologist in the Department of Cardiology at Amrita Institute of Medical Sciences. With a strong academic background, Dr. Praveen Sir has published original research in both national and international forums. He also coordinates the MSc and B.Sc cardiovascular technician courses and teaches undergraduate, graduate, and postgraduate students in medicine and cardiology. Dr. Praveen has also been an active participant in several international seminars. We are truly honored to have him today with us. A warm welcome to you, sir, and thank you for being here to share your expertise with our attendees today. Welcome, Doctor.
Thank you.
Yes, you could start, Doctor.
Shall I start the presentation?
Yes, Doctor.
Okay, thank you. Is my slide visible?
Yes, Doctor.
And I am audible, no?
Yes.
Okay. So good afternoon to everybody. Thank you for coming to the webinar organized by Amrita team for learning the basic nuances of cardiovascular technology course. I will be just dealing with some basic facts about the B.Sc CVT course, and after my presentation, you can ask me any doubts regarding this. Bachelor of Science of Cardiovascular Technology is an undergraduate course in the Department of Cardiology. The basic need for this course is to get cardiovascular technicians who assist cardiologists or doctors in the diagnosis and treatment of cardiac as well as peripheral vascular disease, both in adult and pediatric patients. So in most of the hospitals where cardiologists are performing diagnostic as well as therapeutic treatment, they have been supported by cardiovascular technicians both inside and outside cath lab. B.Sc CVT is a 3-year course, which is an undergraduate course, and it's an important course in the field of medicine. The technology, what is being learned in this course is we have to take care of the patient's parameters while the patients are undergoing various procedures inside and outside cath lab. There are some non-invasive tests. Non-invasive test means we don't do any procedure inside the heart when the patient undergoes tests like ECG or electrocardiogram, echocardiogram, TMT, Holter, etc. And also when we perform some invasive tests, and which is useful in diagnosing and treatment of various conditions in adult and pediatric cardiology. The minimum eligibility criteria to get admission to B.Sc CVT is like any other B.Sc course in the field, where you have to have a 10+2 education in system of physics, chemistry, and biology, or equivalent from a recognized board, which the admission office will be telling about this in detail. A minimum aggregate score of 60% at the end of 10+2 examination, and the other person who should have an equivalent examination which have been cleared from physics, chemistry, and biology at least. Candidates are selected based upon the entrance examination, the details of which we must be already knowing. But I want to stress most about the skill set. What is required for this course? This course is, as I have told, it assists physicians or doctors in performing various diagnostic and therapeutic tools in both inside and outside cath lab. Cath lab is a place where we do certain procedures under the guidance of radiological radiology related radiation related things, which we will explain to you in later. These procedures are required for the treatment and diagnosis of various diseases. And the people who are coming for the course, you should have some affinity for basics in physics, chemistry, biology, as well as to have a mind to perform certain functions which the professional course persons which who are being trained here are routinely doing. They have to help patients in heart-related problems, and they need to have some good monitoring, for which they should have good knowledge of physics, chemistry, biology, as well as some medical equipment, which we will be teaching them. So they have to learn and apply certain basic and advanced life support skills, master some emergency procedures, which we will be training for them in this 3-year course, and certain other parameters, both inside and outside, they should be able to do. And they should be, as in any field of medicine or any field of science, they should learn the basic points, and they should be an effective team player and should have a strong communication skill and a mindset to excel in this field. So as I had already told, it's a 3-year course, and after the course is over, after the examination is over, you have to have a 1-year internship. Based upon the internship only, they will be getting more practical orientation. The course has divided into 3 years based upon the requirement for the requirements which are based on the curriculum. They are divided into first year, second year, and third year. And basically, first year basic things are being taught, and second year and third year they will be more pronounced in the field of medicine. And in the 4th year, after the examination is over, they have to have a compulsory 1-year internship. So these are the first year subjects which are taught: anatomy, physiology, biochemistry, microbiology, quality assurance, and computer science. These are the same topics which are taught in MBBS. When as doctors go for MBBS, they have to learn anatomy, physiology, and biochemistry. The same topics you have to learn at a lower level. And second year, they have to learn pharmacology and pathology and certain cardiac anatomy and physiology and cardiovascular technology. This will be taught, and when you come here, you will learn more about this. And third year is more advanced work, and thesis and research work is compulsory in the third year. And there are some postings when in the initial period, we will be posting them in the hospital where ECG, echo, and treadmill are being trained. And in second year, they have to do some hands-on training in these investigative facilities. And the third year and fourth year, they are posted in cath lab where assist doctors in the performing cardiac cath lab. So this is a treadmill. You must have seen in many of the hospitals where this is a treadmill which is used for patients for exercising. And this is an echocardiogram, like an echo, which is like an ultrasound, which detects the cardiac function. And this is an ECG lab where the ECG, electrocardiography, the basic test is being taken. And this is the cath lab, which I told, this is a radiation equipment procedure where invasive procedures are performed for diagnosis of therapeutic as well as in diagnostic performances in adult and pediatric cardiology. I will stop share now, and I will just share a video now. This video is taken by your previous batch students who are coming to who are being trained here, and you can learn the experiences of them, whatever has been experiences of them from them.
Here we are in front of the camera, and let's take a short outlook on
that. Can you see the video?
Yes, we can see, sir,
And,
but the voice is a bit low.
Okay. That after some time that will become normal. No problem.
Okay.
Sorry, that's okay. No problem.
Under cardiology, stroke medicine, as well as clinical vascular. As well as diabetes. Now we have a quick review of B.Sc cardiovascular technology, which will be said by my colleagues Amrita, Nidhi, and Geta. I'm third year B.Sc cardiovascular technology student at Amrita. Let me give you a quick overview of my course and what we learned throughout these 3 years. First year, we focus on theoretical subjects like anatomy, physiology, biochemistry, microbiology, quality management, and communicative English. This year lays the foundation for understanding the basic human science and medical sciences. Second year, we move on to pathology and pharmacology, while also beginning our clinical posting. We are placed in the cardiology department, where we gain hands-on experience with various diagnostic procedures such as Holter monitoring, treadmill tests, echocardiography, and ECG. We also start our posting in cath lab, getting introduced to interventional cardiology. By the third year, our focus shifts primarily to the cath lab, where we are involved in assisting with various interventional cardiology procedures. We get to observe and learn about a wide range of cases, including both adult and pediatric cases, giving us extensive clinical exposure. This course is an exciting and challenging journey that equips us with skill and knowledge to work in the field of cardiovascular technology. Thank you. This is one of our cardiac research laboratory on cath lab. One of the major implementing is the history system. This is the S3 tube, the fluoroscopic table, and the image intensifier. The S3 tube and the image intensifier will be connected to the data. During the procedure, the patient has the fluoroscopic table. The S3 passes through the patient and will be received by the image intensifier. The S3 tube will be operated using the foot pedal, which will be controlled by the physician. PM can be rotated in different planes to produce various angulated views for assisting the procedure, and the fluoroscopic table can also be moved for positioning during the imaging. This will be operated by the cath lab technologist. There shields on the sides, which minimizes the scatter radiations from the X-ray generator. And also, there is a movable glass shield which will be placed in between the physician and the image intensifier. Other hardware for the procedure will be kept and maintained through proper sterilization by the cath lab technologist.
To exercise during procedures, every person in the cath lab should follow certain radiation safety principles. This mainly includes lead aprons, thyroid collars, and other accessories. In cath lab, we have two types of lead aprons, which are available in different sizes and weights. This mainly weighs about 6 to 7 kilos.
Let me share a few words about this great course that is B.Sc in cardiovascular technology. I myself is another product. I joined for the B.Sc program the year 2000. Also completed my master's the year 2000 and joined as a junior faculty in 2021. And subsequently, I was elevated to the senior staff, and now I'm currently working as the chief of cath lab services here at Amrita. ways you can pursue this course. One is in the non-invasive side, that is mostly in the outpatient basis settings. We are looking into various tests like treadmill, or and other is the invasive side, where you will be assisting the doctors in performing wide range of tests, like whether it be cardiac, for example, like angiogram, angioplasty, TAVI, pacemaker, etc., and other peripheral cases like strokes, vascular surgery cases like peripheral angioplasty, OS and B.Sc, carotid stenting, etc. Talking about the academic program, you will have weekly classes which will be taken by various senior faculty, doctors, physician assistants, technologists, and other experts will be coming from different parts of the globe. In addition to this, students will also given hands-on training for different modalities with the help of simulators and web. I'm currently standing in the console room below the cath lab. So you can see this is the place from where we'll be observing the patient. You can see a live X-ray image of the procedure. You can also observe the patient's vital like ECG, saturation, oxygen saturation, blood pressure, etc. From the gallery, you can also see one of our intern students operating the fluoroscopy machine, and we can also see the doctor who's performing the test. This is the reprocessing area where we clean and sterilize all the equipment used during the cath procedure. All the students will initially be posted in this area to help them understand the design and specification of various items used during the procedure. All this put together, as you can very well see, this is a very demanding course, one which requires a lot of commitment and hard work. So all the very best to all the candidates who are signing up for the B.Sc program here at Amrita.
I will stop the video now. If you have any doubts or anything, you can ask me. Thank you.
Thank you, sir, for that presentation. Also, the alumni, all of them have given us a very good experience of theirs, especially in Amrita. So all these attendees who are actually attending should be really motivated about that. Sir, I have a couple of questions to ask you.
Yeah.
Like these students who join cardiovascular technology program, do they have their hands-on experience from the first sem or first year itself?
No. First year, you have to learn some basic courses like basic. They have to learn first the theory part of it, and later only they will be given the hands-on. There is a protocol for starting hands-on, because you cannot have hands-on training in any specialty from the day one itself, because first of all, they have to know what exactly is the subject, and then slowly they have to start.
Okay. Now, sir, coming to the career paths that these graduates who have joined this program, what are the, apart from graduation, like once they completed, what are the other areas like they can pursue their, the same cardiovascular field?
That depends upon the person's skill as well as their knowledge. After passing the B.Sc CVT course, many of them can go for job, that is cath lab technician, as well as for the non-invasive field in the field of cardiology, either inside Kerala, inside India, or outside India, because our courses are recognized everywhere. They can either go for job or they can go for training more than this. There is also an MSc course in CVT in cardiovascular technology in Amrita itself, as well as in various other parts where you have to learn MSc and then you have to start teaching about this. They can go into the teaching career. Some of them go for other medical specialties after learning the B.Sc CVTs. Some people go for other medical specialties. So that all depends upon the person's skill, the person's knowledge about the subject, and their future interest, whether they want to learn, whether they want to go into the job field, or whether they want to go to the teaching field. So that we cannot predict now. That can be each person will have to develop during the period of the course.
Okay. Doctor, now you have given a lot of prerequisites that these students should be achieved. Apart from their having their basic qualifying marks for the No, entrance exam and also for the eligibility. Now, apart from that, doctor, what should the attitude of these candidates be as they join this course and they come for the program?
Basically, any professional course, because this cannot be termed as a, this has to be termed as a professional course, because you are learning this B.Sc CVT course to learn the subject as well as go into the profession. So you have to have, any professional course will require dedication, hard work, as well as involvement in the day-to-day activities. You have to be involved in that so as to excel, because there are many other centers also doing the same courses. But why our course is better is because we have so much of facility here, so much of paraphernalia here, so much of teachers are there. So and what is important is that the students' attitude as well as dedication and hard work. Once they do hard work and with dedication, they follow the courses, they will be able to come out with flying colors.
Okay. Doctor, about their job aspects like in India and abroad.
Yeah, in India and abroad also, there are many of our students from the last 20 years are outside India, in Gulf countries, UK, Europe, etc. So that all depends upon their level of commitment. So I may not be able to predict now itself that you just pass this one, you will get a job somewhere else. That depends upon your way of learning as well as your dedication and commitment.
Okay, thank you so much, doctor, for that. Doctor, I'm grateful for you spending all your precious time here with us for this explanation of this program in a very simplified way. So before we wind up, doctor, we have Sanuja from the admissions who will just tell us about the admission process briefly.
Sure. Okay.
Sanuja.
Thank you, ma'am. Good afternoon all. I am Sanuja from Admission Office, Amrita Institute of Medical Sciences, Kochi campus. I will give you a basic knowledge about the admission process of B.Sc cardiovascular technology. And Amrita offers 17 allied health sciences programs, and B.Sc cardiovascular technology is one among them. And also the sir said that the duration of the course is 3 year plus 1 year compulsory internship. And the eligibility will be, the candidate should be of minimum 17 years of age and maximum 23 years of age as on December 31st of each admission year or academic year. And coming to the educational eligibility, there's 60% aggregate marks in physics, chemistry, biology. And for all specialties, selection will be based on the marks obtained in the Amrita entrance examination and an online interview. This is our website and portal you can see in the screen. Our website link is amrita.edu/admissions, and the registration portal link is applyug.amrita.edu. And you can see all the examination details in our AEEL link, that is amrita.edu/admissions/AEEEL/. And the examination will be computerized online exam to be taken at the selected centers to the candidates. And the syllabus will be based on +1 and +2, physics, chemistry, and biology. Now the slot booking will be available. You can download your admit card, and the slot booking will be starting from May 13th onwards. And the examination dates will be May 17th and 18th. And it will be conducted in 2 slots, that is 10 to 12 and 2 to 4. The candidates can select any one slot and any one day for the examination. And the results publication will be on 4th week of May tentatively, and the centralized seat allotment process starts tentatively on last week of May, and the allotment will be first week of June. These all are tentatively, and the examination will be May 17th and 18th. Coming to the question paper pattern, a number of questions will be 25 each questions from physics, chemistry, biology, and 5 questions from English. And total 80 questions are here, and total 240 marks. And the duration of the entrance exam will be 2 hours, and you will get 3 marks for every correct answer, -1 for every wrong answer. Coming to the fee structure, we have 3 categories: scholarship category, non-scholarship category, and NRI categories. The tuition fees will be 1,80,000 per year for scholarship category, and for non-scholarship category, it will be 2,60,000 per year. And also for NRI, it will be in USD. You should pay in US dollars, that is 5,500 USD. And for first year only, you have to pay the admission processing charges of rupees 2,500. And we have another fees for both categories that will be 41,000 per year. And the hostel and mess fees will be 80,000. The hostel is not compulsory for those who residing within 20 kilometers. This is our screen page of registration Amrita online admission portal. And we have 5 steps for registration. And first you have to register with your email ID and password, and then fill your profile. You have to fill your personal details and all. Then second one, courses. You have to select your first preference, and you can give lot of preferences under the head of courses. And the third step is payment. You can make a payment of rupees 550. And we have 5 methods of payments. You can select any one method of payment. Then fourth step is academic information. You have to fill your 10th percentage and the school last studied, all the details you have to mention there in the head under academic information. And last, documents uploads. In whichever documents you have, you can upload it. After the +2 results and after the certificates you will get, you can upload it later. This is the admission inquiry numbers. You can see in this page in the screen, and these are the numbers. This will also in our website. And UG email IDs, ugadmissions@aims.amrita.edu. You can send any doubts regarding the admission process, or then you can send a mail to ugadmissions@aims.amrita.edu, and you can see these numbers in the screen. You can feel free to call us. And please take care of this. Amrita, we have not appointed any agents or third-party clients for securing admissions. If any doubts regarding the admissions, you can call the admission office numbers, and the admission office numbers, and feel free to call us. Okay. Thank you, ma'am, and over to you.
Thank you, Sanuja, for that admission process that you have explained. And sir, I think I don't see any doubts raised by anyone so far. So they are clear with what you said and you presented to them. So I think we could wind the session. And I express my sincere gratitude to you, sir, for sharing the valuable insights. And also I thank each one of you for joining this webinar today. Hope you have found it informative and beneficial. So with that, I think we could conclude today's webinar. Thank you once again, and hope to see you all soon in the Amrita campus. Thank you. Have a great evening.
Thank you.